Over the past month, we've tried asking Governor Kay Ivey about his statewide masking policy. With coronavirus cases on the rise, we also pressed to learn if the governor would consider any rollbacks on business openings. She hasn't answered any of our questions. So today, we took them to State Health Officer Scott Harris. The governor says she consults with Harris on health decisions connected to the pandemic. WAAY 31 anchor Pat Simon asked Harris the tough questions Ivey repeatedly dodges. Listen when Pat pushed Dr. Harris about the mask ordinance that took effect just a few minutes ago.
Do you think that the state as a whole made a mistake in not implementing this earlier?
I think that we did the best we could do. Again, there's a perfect public health world in which we could have shut down and all started wearing masks in January. That would have really put a stop to this.
But it would have,
possible.
But doctor, it would have helped put a stop to it. I mean, that's why I was talking about a little bit earlier when we were discussing what we knew then, the stay-at-home order. This cases were being like leveled, if you will, and then that was probably not the perfect time to implement some mandatory mask policy.
Yeah, I think clearly we have tried to get people to do that all along. The people who get it, the people who understand the implications of what's going on have adopted that behavior, and many local officials have worked with us on that. The people who have not gotten it, I'm not sure if they're going to get it or not. But we've done the best we can to bring everyone along. It's very challenging to order people to do things that they simply don't want to do. But I think now is the right time to do that, and I commend the governor for doing that.
And very quickly, if this masking policy doesn't work, if we continue to see spikes in numbers, what would it take, do you think, as the state's top health professional, to roll back the openings, especially of some of these close contact businesses? What would it take?
Yeah, I think that we don't have a defined number or set of policies that are going to automatically kick something into place. I think that the health orders that are in place are effective, and that there's no need to close anything again if people will simply comply with that. If people aren't willing to do that, if numbers continue to go up, then there are certainly other options that we may have to look at.
You're saying if people are not complying. Give us worst case scenario then if we're continuing to see these spikes. What are you looking at? Is there like a number that you're seeing like that is going to overwhelm the hospitals?
Yeah, I don't think there's a set number, but I think that qualitatively speaking, that's actually the issue. The biggest concern we have is exceeding our healthcare capacity. When we don't have room in hospitals to take care of people who need help, whether we're talking about COVID patients or we're talking about patients with other things that folks are hospitalized for. That's really going to be a very difficult issue for us to deal with. When you don't have hospital beds, then you don't have hospital beds, and it's hard to create those out of thin air, even though we certainly can come up with ways of creating alternate care sites or trying to expand capacity. But you just can't do that forever, and that's really a concern, and that's something that we are really thinking hard about how to deal with.